This video provides instructions for patient functional ability scoring within clinical ACE. The world of healthcare and speech pathology services is ever changing. Value-based care is a healthcare model that looks for quality improvement of healthcare services provided to a patient. How do speech-language pathologists show the value of our services? And how do we show progress over time? The answer is functional ability scoring, or FAbS. The functional ability score, or FAbS, is a 7-point rating scale that describes a patient's abilities over the course of speech-language pathology intervention. FAbS is adapted from ASHA's National Treatment Outcome Data Collection Project and is copyrighted by Applied Clinical Excellence. In the FAbS model, the rating scale for each measured area ranges from the least functional, level 1, to the most independent function, level 7. Simply put, FAbS is a scoring system that shows a patient's progress and response to skilled intervention over time. Within clinical ACE, FAbS is required after an initial plan of care is created for a patient. This establishes a baseline functional ability score for the patient. After an initial FAbS is entered for a patient, FAbS is subsequently required every 12 months, but it can be completed at any time by the clinician. Anytime a new FAbS is entered for the patient, the 12-month timer will reset with a new due date for the next FAbS to be completed. When a FAbS is due for a patient, ACE will send an inbox alert to the treating clinician. When a FAbS is due, the clinician will be unable to document any progress note or evaluation for the patient until the FAbS has been completed. When a discharge summary is completed for a patient, the clinician will also be required to enter a final FAbS at the same time. Now that we understand the purpose of FAbS and the rules related to the scoring, let's see how a FAbS is entered into clinical ACE and scored for a patient. When a clinician receives an inbox message to complete a FAbS, the clinician can click on the message attachment to automatically be directed to the FAbS entry forms for the specific patient. If a clinician is choosing to enter a functional ability score at the time of their own choosing, the data entry form may be found by opening the patient record and clicking the Functional Ability Score button that is located on the Documentation tab. The clinician will begin by entering the date of the functional ability score. For example, if an evaluation was completed for the patient last week, the clinician would choose the date of the evaluation. The clinician can choose to enter a FAbS and choose the most appropriate date of the information being entered. The clinician will then click Continue. Next, the clinician will see options for various functional ability measure areas. This is thoughtful consideration for the area of intervention that will be targeted in therapy services. The clinician will select all areas that they plan to score for the specific patient. Once all FAbS measure areas have been selected, the clinician will click Continue. Next, the clinician will see the data entry form for the first functional ability measure area. In this example, the clinician will be scoring speech. In order to determine the most appropriate score for the functional measure area, the clinician will click the Help button located in the upper right portion of the form. The Help button will display the exact score criteria for the functional measure area. Once the clinician has determined the functional ability score for the patient and the measure area, they will select the score from the drop-down box. This action will cause the definition of the score to appear in text format below the selection, enabling the clinician to verify the appropriate score selection. The clinician will then be able to enter comments regarding the scoring if desired. Comments are not a required field. The clinician will click the Continue button and navigate scoring all remaining previously selected functional measure areas for the patient. Once the FAbS is complete, the clinician will be able to preview the report that will automatically be filed in the patient's EMR. The report primarily consists of two main features. The first one is a bar graph that will show progress over time. The second is a chart that shows the score, definition of the score, and any comments. After previewing the document for accuracy, the document may be electronically signed. Now let's take an opportunity to discuss subsequent FAbS that will be entered for the patient. When a subsequent FAbS is entered for any patient, the functional ability measure areas that were previously scored will be pre-selected and will display the score on the button. This will ensure that the clinician scores the areas that were previously scored. Additionally, the date of the last functional ability score will appear in the header of the data entry form. The clinician will follow the same process for scoring each functional measure area. Once all scoring is complete, the clinician will be able to preview the report. The clinician will notice that each new FAbS created for a patient will create a new colored entry on the FAbS bar graph. This visually shows a patient's progress in response to skilled intervention over time. It should be noted that if a patient shows no progress between FAbS and they are not at an independent level 7 for a measure area, a notification will be sent to the clinical review group to determine if services are still warranted. A clinician should also be aware that a FAbS will automatically be required upon completion of a discharge summary. The clinician will simply continue from the discharge summary directly into FAbS. Once the discharge summary and final FAbS are complete, both documents will be sent to the patient's primary care physician. Every time a FAbS is entered for a patient, that data is tracked in Clinical ACE. Each step of progress achieved in each measure area is like putting a FAbS coin into a FAbS bank. The progress the patient achieves is real, is tracked over time, and shows the value of the skilled therapy services provided. Additionally, FAbS data correlates to a clinician. The amount of steps achieved across the clinician's caseload are credited toward their virtual FAbS bank every time they complete a FAbS and show progress that has been made. It's not how many patients you can move from a 1 to a 7. FAbS calculates all upward movements on a scoring scale. FAbS gives clinicians a way to show that they have made functional gains and progress during the time that they have treated the patient. The clinical user will want to complete a FAbS prior to transferring the care of a patient to another clinician. FAbS is also required at the time of discharge, no matter what the reason for the discharge. So progress is always accounted for during the episode of care. This concludes the instructions for ACE's functional ability scoring for patients. For further information, feel free to watch the video again and pause as necessary. Additionally, you may consult the written Clinical ACE manual for detailed instructions and screenshots related to specific features and tasks.